All right, everybody. Thank you for joining today's webinar. First and foremost, I want to thank you just for tuning in. Today's webinar is going to be focusing on healthcare and caregiver and healthcare professionals. Just few housekeeping before we proceed. Like I mentioned earlier, everyone is going to remain muted just for background noises and all that. If you have a question, please put it in the chat box and we'll be able to respond to that. We're still waiting for a lot of people, but we'll just proceed before, and I hope people can join us. Just so you know, in case you're leaving early or people are joining late, there's going to be a recorded version of this, and it will be on our YouTube page. You can always go back and watch that as well. Before I proceed, would like you at the end of the session, we'll be sending out a link that would appreciate it. It's a Google view link that we'll be sharing. I would appreciate if you can help give a review after the session. It helps us to be able to continue providing free webinars to people. Without taking too much of your time, I would pass on to Lola, who is going to be sharing today about the webinar. So Lola, over to you.
Awesome. Thank you so much. Thank you once again for joining and for being a part of your interest in learning more about pathways to Canada for healthcare professionals. My name is Lola. I am an immigration consultant, a regulated immigration consultant. So I'm just going to try to share my screen here, just having the moment. Are you able to see my screen? Are you able to see my screen? No? Okay. Sorry about this. Just a moment. How about now? Can you see my screen? Awesome. Oh, you could see it all along. Sorry, but I thought someone said no, they couldn't see our screen. Okay, awesome. Okay, so we'll go ahead and start. I'll tell you a bit about myself. My name is Lola. I am the lead consultant here at Learnhow Immigration Consulting. I have been, I have extensive background in immigration consulting, really, and also human resources consulting as well. I've got over 8 years of experience over different in different areas of HR and as well as in immigration consulting. I am regulated, so I'm considered what you would call an RCIC. And so I am recognized by Canadian law to provide immigration services. I've also got a designation in HR as well. I've got, in terms of education for immigration, I do have a diploma from the Ashton College, and also a master's in HR as well, and a bachelor's in psychology. And so today what I'll be doing is really just going over just what you're all here for, really, to hear about the different pathways that's possible for people who have who are healthcare professionals and also caregiver experience as well. Okay, so what we will talk about is really talking about, why Canada? What are some reasons that people decide to move to Canada? And then also we'll talk about PR pathways for healthcare professionals. We'll talk about temporary work permits for healthcare professionals. Then we'll talk about the caregiver pathways that they've had in the past and upcoming ones that we're looking for them to bring out soon. And also next steps and how you can get started in your Canadian journey. So meet Sandra. So Sandra is a 32-year-old general practitioner from Nigeria. So her income was really barely enough for her to survive in Nigeria. She couldn't, she wasn't making enough based on the rising cost of things in Nigeria. And so she really dreamt of a better life in a new country as a doctor. She'd heard about fellow doctors who'd moved to Australia, they moved to Canada, to the UK. So one day she decided to approach an agent and speak with that agent, and who had promised her that she would get her a job and a visa to move to Canada. She paid close to over 2 million naira, really was all her life savings to the agent. And then 6 months passed and she did not hear any updates from the agent about any job or even her visa, so-called visa application. After a year, the agent was no longer reachable, unfortunately. And so Sandra came to understand the hard way, be it that you can't pay any agent for a positive visa decision because there's no agent or consultant that can guarantee you a visa or permanent residency when it comes to moving abroad. So that's just how I wanted to start, where you have an understanding that there's no promise or there's no one that can guarantee you this. There's only programs that the government has that put in place for you to be able to access an opportunity to apply for permanent residency. Okay. So when it comes to, I'm assuming most of you here are healthcare professionals of some sort or interested or have a background in healthcare profession. So here are some in-demand occupations that Canada currently does have when it comes to this. They include, there's registered nurses, dentists, pharmacists, physicians, medical laboratory technologists, occupational therapists, physiotherapists. Canada has a high demand for healthcare professionals and foreign-born doctors to really play a crucial role in maintaining the smooth operation of their healthcare system. There are various immigration programs available for physicians who've completed their medical education outside of Canada that would enable them to establish lucrative careers here. The country, Canada specifically, has faced severe shortages of skilled physicians and surgeons. Sometimes the wait times to see a doctor here or to perform for surgery, it can be months at times for citizens here. And that's really because there's that shortage of skill sets. There's estimate that there are up to 40% of new job openings in medicine may remain unfulfilled between 2022 and 2031. Even with the new graduate physicians and surgeons that they have here in Canada and other healthcare professionals, sometimes the wait time to even see a psychologist, a good psychologist, or occupational therapist can be a while because of there's a shortage when it comes to those skill sets as well. So many provinces actually have listed medical occupations ranging from surgeons to as in demand, and there are federal and provincial governments that are encouraging foreign-born doctors or foreign-born health professionals like yourself to come and settle and live in Canada. So that's the good news. Sometimes a lot of times they also earn, well, not sometimes, generally they earn very generous salaries, doctors and healthcare professionals. Sometimes physicians can be self-employed and have their own private practices. And they also have like a pay for service model for physicians where they get paid by the provincial healthcare system. When we say provincial, it's like saying state. So Canada has provinces, which is our version of states in Nigeria. And most other countries. So they do get paid by the province's healthcare system, and the median income for roles like physicians can be 200,000 and above, and sometimes for specialist doctors, $250,000 and above. Now, just to keep in mind, though, for a lot of these healthcare professions, there are accreditation processes and licensing to work in Canada. The licensing process really varies from province and territory, and and you would need to usually visit the province to find out about what you need to undergo for that license process. So usually when you relocate, whatever program you come through, then you need to go through the licensing process for you to be able to start working as a healthcare professional here. And so that's really crucial for you to understand, what you're coming here to do, and if you even would meet that licensing process as well. So usually the first step would usually when you arrive in Canada, because this is what a lot of people say, okay, I do want to move to Canada for my healthcare professional, but I don't want to come, I want to come here and practice what my profession was. So let's say you get to Canada. Upon arriving in Canada, you would need to, like I mentioned, approach the right regulatory body in your chosen province. And then you need to complete an assessment for like nurses. There's the National Nursing Assessment Service. And that verifies your credentials against Canadian standards. Then there's, and usually there will be fees you have to pay to the province for the provincial regulatory body rather. And sometimes it does require additional educational programs to meet the licensing requirements. Doctors have what they call the Licentiate of the Medical Council of Canada, and that's essential, which is called LMCC. And sometimes but due to the shortages of doctors, a lot of provinces are trying to reduce some of these requirements so that it makes it a bit easier for foreign and international medical graduates to settle in Canada permanently. Like recently, they did remove some part of the testing, mid-2021, they removed some part of the testing for doctors so that they can pass. They just have to take one exam for their, which is called the LMCC, and they just have to take one exam instead. So really getting a job in your profession when you do settle here can be a challenge. So keep that in mind if you're trying to use this as the route to move to Canada. But provinces are looking for ways to reduce some of these bottlenecks so that it's easier for people to move to Canada, or at least move to Canada and work in Canada when they get here. So now on to the immigration programs. So you've got the permanent residence options, because honestly, I always tell people, if you are trying to move to Canada, and you want to settle here, rather than coming through any temporary route, first check if you meet any of the permanent residency options. Now, Canada does have pathways that's tailored to attract healthcare professionals. And these programs include the express entry programs and they're doing this because there's a high demand for healthcare professionals. They want to streamline the process to make it as easy for people to be able to come here. And so they look at your background, really, your work experience, your education, your language skills. Those are some of the things they look at to make sure that you can meet some of these requirements. Now, there's the express entry, which is the fast track system, which most of you probably have heard about. And they target healthcare workers in that program. There's a provincial nominee programs, and some of them target healthcare programs. And there's even the Caregiver program as well, which is a pathway where caregivers who have experience can work in Canada, can then have a pathway to apply for PR. That's how it's usually been in the past. Okay. Now, I talked about the express entry, and I'm just going to give you a brief overview of how that works. There's the CRS score. So whenever you see an express entry draw, it means that people have submitted a profile for them to be able to apply for interest to apply for PR to Canada. And it is a points-based system. So if you meet the CRS cutoff score for an express entry draw, then you would get an invitation to apply. And that invitation to apply is for you to then apply for permanent residency. So that's how it works. Now, the National Occupation Classification, this is really crucial and very important to know. There are different occupations, and this is how Canada verifies that you meet the qualifications for the occupation that you are claiming that you have experience, you have education in, to come as a skilled worker to Canada. So it's based on, like I said, your training, your education, and your experience. And this was recently revamped in 2021. So they do have, and these are just a couple of programs that I wanted to point out here, a couple of programs that or the occupations rather, that they are targeting right now for express entry. So which means that they have specific programs, a specific draw where they're targeting these occupations to see and inviting such people to apply for permanent residency. And then under the express entry, there is the federal skilled worker program. And this is where most healthcare professionals would fit. It's there are requirements where they use, like I said, the CRS score, and then also the eligibility of your work experience, your language proficiency, your education, your residency, if you have you've resided in Canada before, or you have someone who resides in Canada, that you can get points for that. And then, of course, at the end, there's the license process, which you get when you come in. So I mentioned that they are targeting healthcare professionals right now, healthcare people that have healthcare experience. And these are some of the other ones. So the first list I showed you was some other professions that they're looking at. And these are some of the other professions as well that they're looking at, from occupational therapists to psychologists to specialists in surgery, veterinarians. Those are some of the areas that they're looking for. And the first draw was done in 2023 June for healthcare professionals. Now, like I said, before they weren't they used to just do general draws, but now it's more, they have opportunities where they're like looking specifically for healthcare professionals, just to show you how important healthcare professionals are to the Canadian government for people to move here. So that's for the express entry. We're going to move on to the provincial nominee program now. So for the express entry, what I find is that a lot of times people have the challenge where they are not scoring points, the right amount of points. So, the cutoff score right now is quite high, let's be honest, especially for people who are above a certain age, like mid-30s and above. So you might be in the profile, you might be in express entry pool, and they just have not called you to apply for PR. So the provincial nominee program is where that would be where you would want to then find a need to be able to meet the requirements. The provincial nominee program varies, and there are different programs within each province. So in New Brunswick, for example, they've got the New Brunswick International Educated Nurse Program. In Nova Scotia, the Nova Scotia Labor Market Priority Stream. In Ontario, the Ontario Human Capital Priority Streams. International Health Workers EOI pool for Saskatchewan. And in BC, the healthcare professional category is available as well for skilled immigration and express entry immigration pathways. Now, keep in mind, you'd want to visit the website for each of these provinces to get more information about what their requirement is. But some of these programs require you to have a job offer. Some of them don't. Some of them, all you have to do is be in the express entry and show that express entry pool rather. And because you're in the express entry pool, they will send you a nomination. A province will say, hey, we want people who have this form of experience. We want people who are nurses. And we're going to send out a nomination through the express entry pool to said people. So in those cases, you don't need a job offer, but you need to at least be in the express entry pool as well. And that's why it's always recommendable when in the express entry profile application, when they ask what provinces are you willing to move to, are you interested, you usually would say all of the provinces, so that gives you a chance that they wouldn't then, any province can contact you and invite you to apply. Because when you get a provincial nomination, you get 600 points. And once you get that 600 points, that puts you at a higher score level. And then you're able to get an invitation to apply as well for PR. So that's for the provincial nomination program. So next, we're going to discuss temporary programs or temporary residency. Now, the temporary resident programs is really for people who are like, you know what, I'm not getting a provincial nominee from any province, and I just want to start with moving temporarily, or I just want to, you don't want to keep your eggs all in one basket. You might want to figure out a way. What's a way that I can still move to Canada on a temporary basis? Because the truth is, once Canada is one of those I would say it's one of the most easiest countries that once you move here, you can find an opportunity with gained experience as a temporary worker. You can then possibly find a way to apply for permanent residency. So all is not lost if you do move here as a temporary resident, but it's through what we call the LMIA process. But the first thing for that is you do need to get a job offer, which is not so impossible because the reason it's not so impossible is because, like I mentioned, healthcare jobs are hard to fill. And people are looking for caregivers, they're looking for different occupations, psychologists, different occupations to fill. And some companies would be willing to give you a job offer and sponsor you for a labor market impact assessment, LMIA. And once you get the job offer, you then, which you can actually look for jobs through Job Bank, the Government of Canada's Job Bank is where you can look for jobs. A lot of employers are required to post their jobs on Job Bank if they want to sponsor for LMIA. So that's one good thing about it, whereby a lot of employers that post on job banks, they're willing to hire a foreign worker. So job bank would be a place that you want to get job alerts for you to then apply for a possible opportunity with a company. Now, one negative thing about the LMIA process, especially now, it's a very lengthy process. And so it is taking quite some time for people to be able to get their LMIA. So just keep that in mind. But once you do get the LMIA, you'll be able to apply for a work permit. And then actually the work permit is attached to that employer. So it's what we call a closed work permit. So you can only work with that employer. That's the honest truth. And actually with the caregiver program, you can use this route as well. And I'll tell you more about that later. Now, one thing you should keep in mind, it is illegal to buy an LMIA. There's been a really bad culture of people, especially employers, and unfortunately agents as well. And sometimes even some consultants, sad to say, are selling LMIAs to people, unfortunate suspects where they're wanting to, and it can be as high as $20,000, $30,000 for LMIA. It's absurd. So if you have that amount of money on an LMIA, then you should be actually using that money for your proof of funds for a PR application rather than spending it to buy an LMIA, because the Canadian government is researching and they are they actually do a lot of research, and that they have investigators to investigate those kind of situations. And you could be banned from Canada for years, or if not forever, if you are found to have bought an LMIA. So whatever you do, make sure you don't, because let's say even if you get away with it now, when you want to apply for PR, you might be found out. When you want to apply for citizenship, you might be found out. So I always tell people, only follow the legal route when you're trying to move to Canada. So the next thing I'll discuss is the caregiver route for caregiver programs, pathways to move to Canada. Now, there was a lot of buzz around the caregiver program because Canada announced that, hey, we have, and I'll talk more about the updates, but in a bit, but they made some announcements recently. But let's talk a little bit about the history of the caregiver program specifically, just so you have an idea. And so that you're not a willing suspect of anybody who's promising you anything right now about the caregiver program. So basically, the caregiver program, which has always been around. It's a pilot program. And what pilot program means is that it's a temporary program, meaning they're just testing out. They just say, we have a goal. We want to bring in, for example, right now, we know they've said in the announcement they made in June, we want to bring in 15,000 caregivers to Canada, right? And that's their plan. And it's over the period of 2024. This is part of the 2024 to 2026 immigration levels plan. That seems like a lot, right? That seems like a good amount, but honestly, with the amount of people in the world, that's not as much. That means like the cap would close really quickly once they do open that program. So keep that in mind about the program. But like I said, it's a temporary program. Now, the past programs were like the Live-In Caregiver Program, the Home Child Care Provider Pilot, and the Home Support Worker Pilot, which just ended in June. So these programs are now all closed. Don't allow anyone to promise you that they have a program open right now. Right now, there is no valid program open to apply for caregiver program through Canada at the moment. However, part of their announcement is that in late 2024 or early 2025, they will bring out a program. So why they do that is because they put out programs probably 5 years. The last program was ran 5 years. And what they're saying is, let's make a goal. Let's see how this program works. The goal of this program is they put the targets. You can see it on their website. This is our goal for the program. They list it out. When they put those goals there, then they're like, okay, are we meeting those goals? And then when the 5-year plan, 5-year expiry or end time happens, when it ends, they're like, well, you know what? We need to revamp this program, which is where this came in. So let me just tell you what the last program, some of the things that you should be aware of that were negatives about the programs. There was delays in the system in processing people's application, and only a small percentage of PR applications were able to be submitted by care workers. One thing on the other happened. Sometimes I heard of cases where people lost their job, and the job they didn't get the experience they needed, which back then was 12 months experience needed before you can apply for PR. So the caregiver program allowed you to work for a year. That's how the last programs were on. And then you would apply for PR after a year. Unfortunately, some people would lose their job at 6 months, which is why now the current applications that are being assessed, so there have been applications that have already been submitted and they're being assessed. They're saying, okay, if you have 6 months of experience, we'll count that towards your application for PR, because there were situations where people could not get that 12-month experience. So because of that, we're looking at the future of the next program, and we're thinking perhaps the next program will ask for only 6 months of experience. Things like that is what they will do. So they'll look at what did not work for the past programs and implement it according to the new program. So I just also wanted to call your attention to these NOC codes for caregivers. So it's the home child care provider, as well as the home support worker caregivers. So these are the two programs, the two occupations that the last programs use for people to be able to apply for PR. So if you got experience as like babysitting caregiver, childcare living, private home, family caregiver, live-in caregiver, those are for seniors, there's people with disabilities. Those were the kind of jobs that people were able to use. And also personal support worker. Those are the kind of jobs that people were able to use to then move to Canada. So now the upcoming program. So this is the exciting news that everyone heard about. Like I said, it is upcoming. It's not been officially launched. So don't let anyone promise you anything right now. We're based on their announcement that they made in June, is that there's going to be a route for PR on arrival. We don't know specifically how, but there will be a route for PR on arrival. Like I said, the past programs did have a reputation of long delays in caregivers getting their PR. So they're trying to solve that. The Canadian immigration, for the most part, looks for ways for continuous improvement. They're showing commitment to changing this by the new program allowing caregivers to receive PR upon arrival. Then your education. Then, at least if this is still kind of the same, but they actually listed this out as well. At least the foreign equivalent of a Canadian high school diploma. So the education is not that high, but you do need to assess that through one of the authorized agencies like WES or ICAS. And then your work experience. So you do have to have recent and relevant work experience. We don't know how many years or anything, but we know that they changed it for people who currently have applications from 12 months to 6 months. So we kind of have an idea that they might make it reduce the work experience, but we're not sure. We're still waiting for that announcement. Then you do need to receive an offer from a full-time home care job, and it can be an organization. Past programs have restricted employers to be a private household. So you want to get it's organizations at this time that they're willing to take experience from, or rather get an offer from. And then you do have to keep in mind that a lot of caregiver jobs you need experience, like food handling certifications, first aid certifications. So those are some of the things if you don't have, you should think about getting at the moment. And then the language. So at least a minimum CLB of 4 in each language category. So it's still the same. They actually were detailed about that. And the test options will be IELTS, CELPIP, PTE for English, or French, TEF Canada, or TCF Canada. So those are some of the things that we saw in terms of changes as well. And so and just to specify the organization they're looking for is for you can get a job offer from a company that provides care for people with semi-independent recovery from injury or illness. So persons with disability as well. Okay. So next here. Is the temporary pathways to foreign that you can take action on now. So like we said, any of those caregiver programs, they're closed. So they closed in June. They're bringing new ones out. But what can you do? Let's say you're like, I have the experience right now. I want to hit the ground running. Time is clicking. I need to find a way and get my journey started now. You can still apply for a job, to a company to give you a job, right? And a lot of times, some of these companies have like their language, a certain language proficiency, education, work experience, and then you can get that job offer. And it has to be an employer who has an LMIA, or it can apply for LMIA for you. Now, a lot of these caregiving companies, they have experience with LMIA. They use temporary work foreign workers. So they might have LMIAs already, so that's why you need to start networking, right? And then once you get your LMIA, you then apply for a work permit application. And that's a closed work permit application, meaning you can only work with that employer. So you can't get here and then try to work with a different company. You have to work with that employer as long as your work permit is attached to that employer. Unless you find a new job, then you have to do the same process to get an LMIA and have them apply for you in that case. So what are some immigration strategies that we want to, like, what is the strategy really that I would say that you want to take? The strategy that you want to take right now is listen out for immigration news. A lot of times they bring out news. IRCC themselves, which is the Canadian Government Immigration Department, they bring out news about what they're doing, what the update is in terms of any new programs. So other than this program that we've all discussed here, there could be another program where you might fit in, or your spouse might fit in. So you never know. Don't be tunnel vision about your strategy. Open your eyes and ears to see and hear what the latest tips. Follow Learnhow Canada, which is our immigration consulting company. And that's our Instagram page at Learnhow Canada for tips and accurate information. And really don't delay in taking a step towards your immigration journey. Assess your education. I would say if you have the experience right now, the work experience, or you're gaining the work experience, or even if you don't have the work experience yet that you need, let's say for the caregiver, or if you're a healthcare professional and you're currently still thinking about it, it doesn't hurt to assess your education. You never know the bottlenecks that you will face in that process. You don't know how long getting your education assessed will take. So a lot of times, some of the countries, our other countries' education system, maybe there might be, like, I was a client I was helping, and his school would not release a transcript to another third party. It had to be released to him. So he had to go through a certain approval process to get his school to do that. And that took months. So you definitely want to make sure that you assess your education and take your English test. Start the process now. Work on those things right now. Don't waste time and don't delay. Then start sending your applications and networking, especially those caregiver programs. For those, I know that the program is currently closed, but we know there's something coming up soon. And also we know there's the LMIA route. You'd be surprised how many, you can use the LMIA route and how many employers will be willing. There are different caregiving companies out there. You want to do your research and find out, okay, what companies might be able to sponsor me. Get on LinkedIn, network, update your profile on LinkedIn, and then reach out to, there could be a lot of times if you reach out to some of these recruiters, or even as far as the hiring managers, they would be willing to possibly consider you for any opportunity if you show that you give them the information of what you're looking for, or they might be able to point you in the right direction. And then get accurate information. I don't know how many times, I come across a lot of videos, things out there where people are speaking about this is what's happening now, and really and it's not like they're putting false information on purpose. It's just that there's always a bigger story when it comes to Canadian immigration. You see one piece of information, but then there's caveats to it. So if someone tells you this is how you do it, but they don't tell you, however, you need XYZ to do it, then you think that, oh, I have all I need, and you might not have everything you need, which is why sometimes coming to an RCIC registered, regulated consultant like myself or any other RCIC that you can verify can actually be able to give you the accurate information. And sometimes and we don't claim to know everything because the law is changing constantly. This year alone, there have been so many changes to Canadian immigration regulations, but it's our duty and we are bound by a policy and by the government. Basically, it's governed by the government overlooks our profession, is regulated by the government to actually provide you with accurate information. And if we don't, we do have someone to answer to when we don't. So that's why going through an RCIC is a better route than going to a ghost consultant. A ghost consultant is someone who's not regulated, who might call themselves an agent and maybe doesn't have any form of regulation, and no one to answer to really. So you have to be careful with that. And you can verify if someone is a regulated consultant by going to college-ic.ca. This is the website. You can verify, and that's where you can find if someone is a regulated consultant. So that's pretty much it for now. We wanted to give time for questions. So the next steps, I'll hand it back over to Yinka, who will provide us with the next steps. And then we can also then at that time, then go over with any questions that you all might have. So over to you, Yinka.
All right, thank you. And thanks for doing an amazing job as usual. So what is the next step? The next step would be, so currently we have a promo going on, which is a 75% discount that you would get. This promo has been running for about close to 2 months now. We started this last month when we did our live with Bolanle. So the promo is a 75% discount. Instead of you paying 100,000 naira to speak to Lola, if you want to follow up on questions or you want to ask other questions, we've cut it down to 25,000 naira, which is a significant sort of figure if you look at 75% discount. So take advantage of that. This promo is going to end on the 31st of July, which is just around the corner. So if you want to book, you have to do that right away. So the other thing as well is, as Lola mentioned, if, for example, you're already in the process or you started your Canadian application, or you're ready to go, you need to, and you want us to represent you. Also, you can go through that consultation process, or you can send us an email and we can always follow up with you to sort of help you and guide you through that process. Most of the time, I think a lot of people try to leave the process, and or even though you have all the documents, you might think, oh, I'll do it towards the end of the year. But what you're doing to yourself is that sometimes your age might be, so for example, maybe at the time you're 29 or 31. The moment you become 32, then that affects your age. So you need to get on things if you really want to do it. There's no time to waste. The longer you leave it, the more chances your chances of being able to get the score you're looking for would be affected. In terms of consultant fees, we definitely have, depending on what you want to apply for. I can't really give you a direct figure right now because there are sort of differences in terms of, are you trying to apply for PNP? Are you trying to apply for work visa? Are you trying to apply for permanent residency? So the cost for all of those things vary and they're different. But if I'm going to give a range, you want to be thinking of from 1,500, which is to help you fill out your express entry application fee, for example, express entry application, 1,500 to about maybe even $5,000 to help you with the total process of maybe, for example, a PNP. And what that would include is that you need to, for a PNP program, you need to apply through a sort of a province. You need to apply to a province. Then you have to go to the federal government as well. So there's a little bit of differences there, but it's still one for one purpose. So the fees would range from maybe 1,500 to about 5,500, for example, which is 5,500 Canadian dollars. And please put that in mind. We're charging Canadian dollars and not US dollars. So the exchange rate is a little bit different as compared to Canadian dollars. If you really want to, like, I saw in the comment in the chat, someone is saying, how can I book a consultation? I'm going to send the link in that chat box for anyone else. Once you make the payment, then we will schedule a meeting for you to meet with Lola, and then you can start your journey that way. So for any other questions, please feel free to drop it in the chat, and I'm sure we'll be able to touch on that. So I will pass it on to Lola for Q&A. The style and the way for this Q&A session would be, because we have about 60 people, we would just appreciate if people can send us chats, and then we can read that out and answer those questions. If we can't get to your question because of if we can't get to your questions because of time, I would suggest that send us an email. We'll leave our contact email contact there. Send us an email with your questions regarding today's webinar, and we would be able to follow up with you on that as well. I would also suggest that you follow us on social media. I've shared the links in there on YouTube. This webinar is going to go on our YouTube page, so you want to be able to rewatch that. So I'll suggest that you subscribe to our YouTube page, you follow us on LinkedIn, because there are a whole lot of information that will be coming out from now and over the next few months. So I'll pass it on to Lola for the Q&A session. And please remember that we would only take questions that goes into the chat box. Thank you. So over to you, Lola. I think you can take over from there. Lola, can you hear me?
Yes, I can.
Okay.
Okay. So regarding the question, if it's safe to assume that when applying via the upcoming caregiver program route, it's not necessary to apply for an LMIA. So thank you for your question, Vivian. So like I mentioned, we don't know specifically. Generally, with the caregiver program route, you wouldn't need, at that point, you wouldn't need an LMIA. That's usually how it works in the past for the caregiver program routes. We don't know what the new route would entail in terms of that. But right now I would say that's why I mentioned the LMIA for caregivers. Now, the way to go through is just like any profession, including caregiver. If you want to move to Canada with a work permit, you need LMIA for most programs, for most occupations rather, unless there's a specific type of occupation where it doesn't require LMIA. But right now, caregiver does require LMIA because there's no open program at the moment. So the upcoming one, we don't know if you would require. In the past, you haven't required. You haven't needed that. Someone's asking about that NVQ3 diploma. I believe that's a UK requirement from what I remember, from what I know. So for Canada right now, the past caregiving route, you just need at least equivalent to a high school diploma. That's what you need, equivalent to a high school diploma. That's how it has been in the past. And a lot of times they mirror the process. They mirror when it comes to the requirements for a program, they mirror what the NOC code requires, and they really mirror what employers are looking for the most part. So that National Occupation Classification has done, it's like a research they've done on occupations, and whenever employers are looking to hire caregivers, what do they look for? So that's how they came about what is required. And a lot of the jobs don't always require you to have bachelor's degree. You might just need an equivalent to a high school diploma. Can we know the approximate time to get a response to an LMIA considering applicants' info already in the system? So for the LMIA, it's the employer that's being assessed. It's not the employee yet at that level. So it's the employer. So the employer needs to go through a whole bunch of, they look at their taxes, they look at their income, they look at their, sometimes they even go for inspections, very rare, but sometimes they might inspect where they say the person's going to go work. They look at so many different things, and it's the employer. So that's why it takes right now, it's taking about 8 months. Once it's 6 months in, then we can put a rush on it. We can not put a rush. We can check with ESDC. So ESDC is actually the government body that looks at LMIA. And then your work permit is processed by IRCC. So those are two separate kind of bodies. They work together, but they're really two separate government bodies. So your biometrics medicals is not with your LMIA. That's your work permit side. That's the work permit side. Work permit can take, it depends. Like, if you're in Canada, before you could go to the border and get your work permit in a day, but that's not the case. They've closed that right now. So right now, it can take some months to get your work permit at this time. Someone asked how they could book a consultation, and we've provided you with that information. In cases where provinces pick someone and the CLB required to enter the pool is CLB 7 and you have CLB 6, how do you go about that? If there's a requirement for a certain CLB, like I'm saying your English proficiency, that is the requirement. So they won't make an exception. Like once they have a minimum requirement, that's it. You have to then redo the test, the English test, and then update your details in your application. Does this caregiver program require coming with family? So usually in the past, the programs you have to bring your family later. Now they said that they're making a program that you can bring your family and add your dependents to the PR app for your application as well. So in terms of requiring, there's no require for caregiving because of it's generally a temporary way to move here. It's a temporary route to a PR application. That's really what it is, what it's been in the past. Now we're hearing different, right? That they're going to give you PR upon arrival, which is why you would be including your dependents from the beginning of your application. That's what we're anticipating. Did caregivers come in the past? Did caregivers who came into Canada through the caregiver program route need to go through a licensing process before being allowed to work? Not specifically, and it really depends on the job. So some companies might require you to have a license depending on the job you're doing. But in general, once you met like the requirements I said, which is the diploma, you get a job. So for the caregiver PR, like the temporary the program itself, it didn't have a licensing process. The licensing process is with the company. It's when you want to work. So it's when you need to work or when you need to get that job. That's when a company might say, we need you to have a specific license. So companies have different requirements, but the program itself didn't require like a license for caregiver. Currently undergoing a training HCA in Nigeria. My main concern is how to get to job abroad. Do you have a recruiting agent we can work with in that respect? There are recruitment agencies that you can find. We don't have one specifically, but there are recruitment agencies that you can access online as well. But we are working on getting such information for people for caregivers. Right now, we don't have a specific recruitment agency just for caregivers, but I can recommend agencies in general that do apply for that. What can you say for medical laboratory scientist? Well, this does require you to contact, it really depends on the province as well. So I think I actually have, I had something I was going to show you guys. Oops. Can you guys still see my screen?
Yes, we can, but we can't see. I think it says thank you for your attention as well. We can see.
Oh, okay, yeah, the next slide. And I'm just working on bringing that up here. But basically while I'm pulling that up, a lot of these programs, specific occupations, each province has its own requirements. So you have to go to the province that you're interested in, which is maybe all of them, or the ones with the province with the least resistance, or at least the not as much bottlenecks. And you would want to go to them and find out what they require for your profession. What is required for you if you need to move to Canada. And another thing, what is required what is required if you need to get a job in their province? Excuse me, that's what I meant to say. What do they require if you do need to get a job in their province? What are they looking for? And I'm just going to show you this now, which shows like some of them, and you could start here for some of your professions.
We can't see your screen anymore. We can
Okay.
only see your video.
Can you see my screen now?
Yeah.
Yeah. Sorry. So yes, these are some of the bodies that govern the different professions. And so you would want to go ahead and speak and look into this and specifically look into what they might say that is required. That's some of the things you do. And that's some of the things that if you need us to do a specific consultation on your specific skill, that's what you would be paying us to do that research for you because these programs change. Like I said, the provinces are changing the requirements quite frequently because they are wanting more foreign workers to be able to meet the requirements to be able to practice. I can't tell you how many times, and it's not a stereotype. I'm in an Uber car, and it's an immigrant who used to be a doctor back home because they are still trying to meet the license requirements to be able to practice as a doctor here, or to be able to practice as a nurse or a chiropractor, or as a dentist. I met someone once, he came here 12 years ago and still just was too expensive. The fees are quite expensive a lot of times for people to be able to take those tests, do an extra program, do an extra course to be able to finally practice in your profession. And so it's really good that's why I always tell people, it can be quite destabilizing when you get here and you can't practice in your chosen field, right? It's not just about leaving your country and moving here. It's about being able to pursue and continue what you're passionate about. So that's one of the things that we do research for you as well. When you book a consultation with us, even the 45-minute consultation, we give you an evaluation form. You tell us, hey, I'm a medical, technologist. I want to medical laboratory technologist. I'm looking at this province, or I need to know what province is the best that I can move to. That's the research that we do for you, and you pay us for to be able to give you the right information and let you know what way to go at that point.
We lost your screen again.
Oh, I took it off.
Someone is asking about.
Someone asked for a reliable agent.
Yeah.
So just to clarify, I am what you would consider a agent. So that's what I am. I'm what you call a reliable agent, because I'm not, and the reason why is because I am, aside from my values, of course, of being reliable and honest, I'm also regulated. So if I do not deliver on what I promise, we sign an agreement, you can take me to the College of Immigration Consultants and say, Lola did not, this is what she was supposed to do. She didn't do it. And I can lose my license for practicing for that. I have an accountability to the government, actually, of Canada to accomplish what you would hire me for. So that's what you would, I know you guys people call it agent, but we usually say immigration consultant. And it's the same thing as an agent. Agents generally, anyone that's not, or any reliable agent would be a regulated immigration consultant. That's who you're looking for. Anyone else, you cannot hold them accountable. There's no one that can, like, let's put Nigeria in lingo, no one can jack them. Nobody can jack them if they're not regulated, basically.
I think someone is asking about medical laboratory technologies.
Yeah, I answered that.
Community health extension worker apply, can they?
Is that related to basically someone who does rehabilitative healthcare? if it's that kind of program, basically, I'm guessing, I believe that's what the program does, basically. And like I said, actually, I want to show you guys the NOC code and how you can actually find that out for your NOC application, because it's not a secret. Like, you can actually look for what your code is yourself. We can do it for you, or you can do it yourself. But basically, like, for example, this person has talked about community health extension worker. So we're going to search that by, oh, well, you're not seeing my screen, so I'm just going to share my screen here. Okay. So this is the National Occupation Classification. Some of you might be familiar with this. I'm always curious if people are familiar with this. So if you're familiar with this and have done your search on here, just put a yes in the chat box. So you want to make sure you're on the 2021 version, because that was updated. Sometimes some people do it and they use the 2016. You don't want to use the past version. 2021 is what you want to use. And this person has said, let's just put community health. So that's the job title. And these are basically the ones that the person might qualify under. So you'd have to look into this specifically, and then you'd want to click further, like this, for like, you'd want to click further on the unit group and then look for what that falls under. And it doesn't have to be the title. What you're really looking for is the duties. You're looking for the duties. And if you meet any of these duties here, and then the employment requirements, that's what you have to meet whenever you're looking. So I would say the first step to all of this is knowing what your NOC code is. Like, what's my NOC code? Because your NOC code might be in a provincial nominee program. Your NOC code might be one of the targeted healthcare occupations. So first, find out what your NOC code is, whether you're a healthcare worker, whether you're a doctor, whether you're, a psychologist, a chiropractor, or even any caregiving role that you've done. Just first of all, find out what your NOC code. For caregiving, those two ones that I sent to you earlier, I showed you earlier, are what it usually, that's what the caregiver code is under for those ones. And we can actually look. Let's see here. And you can actually look by code, actually. So if you know what it is specifically. Oh, but we've got a lot of more questions. So let me just, so yeah, basically the NOC code, you can look by NOC code, or you can search your job title and you can be able to find it there. So let me attend to some of these other questions, actually. I didn't see them all. So many popping in now. Question is if we know if the CLI college in Nigeria is affiliated with the one in Canada. I'm not aware of that information. It is information that we can verify for you and look into if you book a consultation, or feel free to shoot us an email. But in terms of education, that part, I'm not familiar if it's affiliated. And sometimes you can contact them directly, like contact them directly if you want to, and find out that information as well. You're welcome, supermodel. Thank you so much for being honest and transparent. Thank you for attending, Zaina. Are there age requirements for applications for medical doctors? So when you say applications, do you mean job applications? Because it's illegal to put an age requirement for job applications. Now, when it comes to your immigration application, there is not age restriction so much as the older you are, then you don't get the points needed for the age, if you get what I'm saying. So it's not about the fact that you're like 50 and applying. It's about at 50, how many points do you get? That's when, I always say that's when Canada is allowed to be, discriminatory with age when it comes to immigration, but not directly. They just don't give you the points you need to get you to that higher point. And do we need to write a license exam prior to getting a job to practice, or are there other routes where we get in while preparing for the licensing board exams? So yeah, so you can get into Canada with your experience as a doctor. It's just then to practice, what I've seen a lot of people do is they become, I will admit it, I've seen people become like, and it's not bad, and maybe a manager at a clinic. A lot of times I've met people who come from Nigeria and they've that's what they first do. They are either or the administrative person, or they're, some kind of, coordinator in a medical clinic. And what they're doing is they're working on getting their license. That's why. With regards to education, if you have 2 or more degrees, which is BSc in science and second degree in computer science, does this still give a chance, or your degree matters as well? So yeah, so a lot of these programs, and that's why I said know your NOC code, and part of knowing your NOC code is basically going to knowing the education and knowing the work experience requirement. So if let's say you want to be, and someone's saying they didn't see the NOC, so I'm going to use this question to answer your question and their question. You just Google National Occupation Classification supermodel. Just Google National Occupation Classification. Right. That's what you would do. Then let's say you're not sure what the code is, you don't want to miss it. So then you decide to go to health, let's say medical administrative assistance or whatnot. Maybe that's what you have experience with. Or let's say you have experience specifically in clinical and laboratory medicine. So these are more specialists. So then you would go here, and then, like I said, you'd look through the titles. These are just examples, right? It could be any of these. And then these are the duties. So some or all of this is what they're looking for. And then the education is here. So this is what is usually required. And when they say is usually required, it means you should have it. If they say may, then it means if you have enough experience, they might overlook the education piece, or it could be a different degree, but it's usually required. And then some kind of specialty training. So, I know we have our own training in Nigeria as well. And then they'd be looking for things like this as well. These are what's required too. The questions. Can one apply for LMA as well as create an EE profile? Yes, I always say don't put I hope I mentioned that earlier. That's my biggest mantra. Don't put your eggs all in one basket. You can apply with an employer to apply for LMIA for you. So you don't apply for LMIA yourself. You can apply with an employer to apply for LMIA and also create your express entry profile. Now, I know some people say that's controversial because when you then want to apply for a work permit, they see that you have an express entry. And then it's like, well, are you trying to come here temporary or are you trying to come here permanently? It doesn't matter. They understand and they've come to know that people are looking for different routes to move as well. So you can apply for, and that's also called dual intent. Like you have the intent to, you can, in Canada, they allow you to have 2 intents for your application at the same time. So you can be applying for like a visitor visa and also have an express entry profile. They understand that you want to visit, but you also want to eventually maybe live there. It's a bit controversial, but you need to give a really good reason in your temporary application to say, this is what I'm coming here for, and I will go back home. So you need to prove that. You still need to prove that in your work permit application, that you will move, you will finish your work experience, you get your work experience, and you will move back home. And at the same time, they understand that you still have a PR application. If you meet the right, I always say, if you get the right officer, we've done it before. We've gone applications for people who have dual intent. If you meet the right officer, they would approve your work permit or your temporary permit while understanding you still are interested in PR. You said my screen wasn't full. Oh, did you see it the second time I showed it, supermodel? Because I showed the NOC code, but I can put the link here actually. Let me do that so you guys can see the link. Make sure you go to the 2021 version. There you go. Lost track of questions, to be honest.
I think you were responding to the NOC code and you pretty much dropped the NOC code to address the,
Yeah.
and I
Okay,
think
so
you
I've responded to that.
I think the next question would come from Chidima, which I think I responded to that. She wanted your YouTube and social media handle in the chat.
Oh, okay, you've done that. Okay. Oh, it's out. Okay, great. Awesome. This question about nurses applying for care jobs. Um, so in terms of the endorsement, the requirement as right now, based on the past program, is that you just need to show you have work experience. So whatever way to do that would be a reference letter. That's how it is from wherever you've worked, that you have work experience. So if it's to get a letter from the Nigerian Nurses Registration Council, you want to provide as much proof as possible. I always say with PR application, it's the easiest route. People think it's harder than temporary route, but it's actually the easiest route than temporary, because you don't need to prove that you're trying to move back home, that you're going to go back. You don't need to prove that. What you need to prove is that you have enough of the skills that Canada needs to move here. You need to prove that I am skilled. So I've got my certifications, I've got my work experience, I have my education. You want to prove that. So if providing that endorsement from the Nigerian Nurses Registration Council will help, absolutely include things like that. But all they ask for is education, verification, work experience proof, and the job offer. But I think one thing about the program is because it knows that the employer has done, usually most employers have done their due diligence to verify you. So once you have that job offer, the job offer is the hardest thing to get for like the caregiver program. Got about a couple more minutes. So if there are any more questions.
Yeah, and just so this video would also be posted on YouTube as well, so people can go back and watch it. For those who came late. I do regular updates on our Instagram page talking about,
Migrating Canada. So absolutely definitely want to, follow us on there to get more updates as well. And we will be sending out newsletters as well, just to have you guys can, for people who maybe might not be on social media, to be able to keep up to date with what we're doing as an immigration company to provide you with value and information.
There's another question from our wall.
Yes, you need a job offer to apply to get LMIA. So what happens is that most companies, they know, but there might be companies who are like, oh, do you have a work permit? And then you say no, but then you mean, in that case, you need to be sponsored. So they'll ask you, do you need sponsoring? Yes. So you do need a job offer. So your job offer will be included in the process as well. So as well, when the company applies for LMIA. Sometimes some companies, sorry about that. It's so odd. My phone is never on ring. It's always on mute. So, but yeah, sometimes some companies do already have LMIA, like they actually have an LMIA available, which is always the best situation, which unfortunately some companies use to take advantage of people and will make you pay for that LMIA, which I mentioned earlier is absolutely illegal. Such companies can face persecution by the Canadian government, and you don't want to be involved in that. And if you have $20,000 to pay for LMIA, that means you have enough money to put as your proof of funds. So it's just a waste of money.
I think because of time, maybe we'll take one or two more questions before we wrap it up, because we're almost coming to the end of the session.
We'll also be sending out like a feedback form, you know, And then also, like you said, a Google review. Oh, a question, just a curious question. Why is it so difficult to get a job offer outside Canada, even when one is highly qualified and has very good experience and track record? Okay, Canada, like Canadian employers, they like to employ people that are referred. I've been a recruiter before. I do recruitment consulting as well, it's apart from the immigration business, right? So, or I have in the past, as well. So they usually, if you can vouch for someone, like if someone can vouch for you, is when they are more willing to hire you. Even within here, for people that have citizens and PR. So that's just why I say networking is so key, because if you tell people, you speak to people that you're looking for work, or if reach out to people on LinkedIn, and your profile looks good, make sure you optimize your LinkedIn profile. YouTube has tons of advice on how to do that. Optimize your LinkedIn profile, look attractive to recruiters, and then that's when you'd be able to get an offer, most likely. So they usually like the people that and they can vouch for. If someone can vouch for, that's really why. Because it can be difficult to get a job within Canada as well.
And you also need, I think, work experience is also it's a Canadian work experience as well, right?
Yes, and sometimes when you don't have the Canadian work experience. But I will say for hard to fill roles, if you have got that skill set and they're like, I've seen employers do it. Someone who was based in Ibadan and their job experience was only Ibadan, and they hired that person from Ibadan because that person had very skilled, a specific skill set that they needed. So if you've got it, they're willing to take a risk. Um, but yeah, Canadian experience can be one that definitely um, is a hindrance.
There's a question about community health extension workers.
I think it's just educating people.
Oh, okay.
Mhm.
Well, I think we're really coming to the end of this session. And I guess with any questions that you have, any other further questions, just send us an email, drop us a message on IG, and we'll be happy to follow up with you there. Is there any last words you would like to share before we wrap it up?
No, I think I'm just really glad to see we've got, 50 people on here who are interested in learning more, and just thank you so much for your time. I know your time is valuable and we appreciate you coming in and learning from Learnhow and how to move to Canada. And like I always like to say, you started your Canadian journey. Your Canadian journey starts here. Some of you have been on this journey for a while. Don't give up. Timing is everything. There's a deadline. There's no deadline per se. Let me just put it that way. So don't create a deadline for yourself because Canada needs people. So there will always be allowing people to have immigration. So in terms of courses, caregiving courses, there are different programs. I know Newfoundland has a program. I heard of a program called I think it's Keyline. So Newfoundland depends on the province. So go to each province and just do that research because there are programs like I believe Newfoundland has a quite popular program and Nova Scotia too. They do those two places have good programs where they give you on the job practitioner experience as well. So that is also another route. The student route. The reason why the student route has been very controversial. They've been denying a lot of people, but that is another route. Getting through the student route is a way that you can also try, which is by taking some caregiving courses as well. So
All right. Well, I think this is a good place to wrap it up. Thank you all for joining. Really appreciate the turnout was great. I hope you're able to learn and gather more information to help you start your immigration journey. So for any other further questions, please send us an email or follow us on Instagram at Learnhow Canada. I'll be happy to answer all those questions that you have. Thank you again, and watch out because we have a lot of webinars coming out that I think will be beneficial to you or your friends or someone you know. So please stay in touch. Just stay glued to our page, and we'll definitely be passing out more information. So once again, thank you everybody for coming this afternoon, and hopefully have a great evening.
And I've put some links for the question about the caregiving courses. Somebody had a question about that. So I put some links in there so you can see, you know, just a little bit of, just click on those links for the course in Canada, as well as the course in like options for courses in Nigeria too.
All right, then. Thank you, everybody. Thanks for joining. Have a good evening.